Hello, SCI team. This week's series number 10, Enhancing Patient Safety on Neurogenic Bladder, is one of the most frequent complications in patients with spinal cord injury, resulting from disrupted neural pathways that control the bladder. Without effective management, this condition can lead to urinary retention or incontinence, elevating the risk of urinary tract infections, renal damage, and autonomic dysreflexia, or AD, a potentially fatal emergency. It is critical for SCI nursing staff to understand that bladder dysfunction is not merely an inconvenience but a significant patient safety concern. Comprehensive bladder care that includes routine assessments, appropriate catheterization schedules, and preventive education forms the cornerstone of quality care. My name is Michael J. Orellano, your SCI nurse educator. As we know, nurses are the first line of defense in recognizing symptoms early and taking timely action to mitigate risks. Proactively addressing neurogenic bladder through vigilant monitoring and education not only prevents complications, but also enhances the overall quality of life and independence for SCI patients. As such, integrating best practices in bladder care is both a clinical and ethical imperative for all SCI nursing staff dedicated to optimizing patient safety and well-being. This educational session aims to build foundational knowledge and clinical competence among SCI staff in managing neurogenic bladders. First, participants will gain a clear understanding of what neurogenic bladder is, including its pathophysiology and the specific ways it affects spinal cord injury patients. Second, staff will be introduced to various assessment techniques such as bladder scanning and symptom recognition to identify dysfunction early. The presentation will also highlight prevention strategies like fluid management, hygiene protocols, and adherence to individualized bladder schedules. Finally, evidence-based interventions will be discussed, including the use of intermittent catheterization, medication management, and collaboration with interdisciplinary teams. These objectives are designed to empower staff with practical, actionable knowledge that enhances patient safety and minimizes preventable complications. The ultimate goal is to ensure SCI nursing staff are well prepared to address bladder management challenges confidently and consistently. Neurogenic bladder is a dysfunction of the urinary bladder due to nerve damage resulting from spinal cord injury. When spinal cord communication is compromised, patients may either lose the ability to sense a full bladder or be unable to contract the bladder for emptying. This leads to urinary retention, which promotes bacterial growth, significantly increasing the risk for urinary tract infections. In other cases, patients may experience incontinence, further contributing to skin breakdown and hygiene challenges. One of the most severe consequences of a full bladder in individuals with injuries at or above the T6 level is autonomic dysreflexia, a condition marked by dangerous spikes in blood pressure. This medical emergency requires immediate attention and intervention. SCI staff must maintain a high index of suspicion and perform diligent assessments to catch early warning signs. Understanding the physiological implications of neurogenic bladder is vital for implementing effective care plans and safeguarding against avoidable complications that compromise both patient safety and comfort. Thorough bladder assessment is a foundational step in managing SCI patients with neurogenic bladder. SCI staff should observe and document voiding patterns, frequency of urination, and any episodes of leakage or incontinence. These observations can help identify trends suggestive of urinary retention or dysfunction. The use of bladder scanners is a non-invasive, effective method to assess post-void residual urine volume and determine whether the bladder is emptying completely. Staff should be trained to use this tool accurately and integrate it into daily routines, especially when patients report discomfort or show atypical behaviors. Additionally, recognizing signs of autonomic dysreflexia, such as headaches, facial flushing, sweating, and elevated blood pressure, is crucial, particularly in patients with injuries above T6. These symptoms may be the only early indicators of bladder overdistension. Prompt assessment and intervention are critical in preventing serious complications. Nursing vigilance and a proactive approach to assessment support early detection and timely care, ensuring patient safety and reducing emergency interventions. Preventing complications from neurogenic bladder requires a proactive, multidisciplinary approach that begins with a personalized bladder care program tailored to each patient's unique needs. Regular catheterization schedules should be maintained and modified based on bladder capacity, patient preference, and clinical response. Encouraging appropriate fluid intake is equally important, as adequate hydration helps dilute urine, flush out bacteria, and reduce the risk of urinary tract infections. Staff should also educate patients and caregivers about the importance of fluid balance. Aseptic catheterization techniques are non-negotiable when it comes to minimizing infection risks. Hand hygiene, the use of sterile gloves, and proper handling of catheter equipment must be routine practice for all SCI staff. Using single-use catheters and avoiding contact with contaminated surfaces are evidence-based strategies proven to lower infection rates. Reinforcing these preventive practices during patient care rounds and clinical huddles fosters accountability and consistency. Ultimately, bladder problem prevention enhances long-term outcomes and supports safe rehabilitation progress. Effective bladder emptying techniques are essential to maintain patient safety and prevent complications. Intermittent catheterization, typically scheduled every 4 to 6 hours, is considered the gold standard for most SCI patients. This approach mimics natural bladder function and reduces the risk of infection compared to long-term indwelling catheters. SCI staff must ensure that catheterization is performed consistently, even during night shifts and weekends, to prevent bladder overdistension. For patients who require long-term catheters due to functional limitations or comorbidities, proper maintenance, including daily hygiene, monitoring for obstruction, and regular tube changes, is vital to minimize risks. Pharmacologic agents such as anticholinergics or bladder relaxants may be prescribed to manage bladder spasms or increase capacity. Close collaboration with urology specialists ensures medication regimens are adjusted to achieve optimal bladder function. Nurses should monitor for side effects and evaluate effectiveness regularly. By combining clinical precision with interdisciplinary support, SCI teams can ensure effective bladder emptying while enhancing patient comfort and quality of life. Bladder retention in patients with spinal cord injuries above T6 presents an acute medical emergency due to the risk of autonomic dysreflexia, or AD. When the bladder becomes overly distended, it sends signals that cannot be adequately processed by the damaged spinal cord, resulting in an unregulated sympathetic nervous system response. This leads to a sudden rise in blood pressure that may cause stroke, seizures, or even death if not promptly addressed. Early symptoms, such as a pounding headache, facial flushing, profuse sweating, nasal congestion, and anxiety, must be recognized immediately by SCI staff. Quick action is critical. The first response should be to check for bladder fullness and empty the bladder using sterile catheterization. If symptoms persist, escalate care promptly to include pharmacological intervention and provider notification. Education, regular drills, and protocol review sessions help prepare staff to respond effectively when a D occurs. Early recognition and intervention can prevent escalation and save lives, reinforcing the importance of diligent bladder monitoring and prompt response in all SCI care settings. Consistent and routine bladder care is more than just a clinical task. It is a cornerstone of long-term health and well-being for individuals living with SCI. By ensuring adherence to established bladder care protocols, nursing staff can significantly reduce the incidence of urinary tract infections and emergency events like autonomic dysreflexia, both of which are common causes of hospitalization in this population. In addition to reducing medical risks, effective bladder care empowers patients. Patients who participate in their care, through self-catheterization or knowledge of their bladder schedules, often report higher levels of independence and self-worth. This sense of control can positively impact their rehabilitation goals and overall mental health. Moreover, routine care aligned with the patient's comprehensive rehabilitation plan ensures continuity and consistency across care settings. SCI staff should encourage patient engagement, provide regular education, and advocate for policy adherence. Together, These actions contribute to safer patient outcomes and a higher standard of care. To summarize, effective bladder care is integral to maintaining safety and quality of life for SCI patients. Early assessment techniques, including consistent observation and the use of bladder scanners, are key in identifying problems before they escalate. Maintaining a routine bladder emptying schedule prevents the risks associated with urinary retention, particularly autonomic dysreflexia, which can be life-threatening. Prevention strategies, including hydration, aseptic technique, and individualized care plans, form the foundation of safe practice. Ultimately, the vigilance and proactive mindset of SCI nurses are what drives successful outcomes. Every catheterization, assessment, and teaching moment contributes to a broader culture of patient-centered care. SCI staff should feel empowered by the knowledge that their actions have a direct and measurable impact on patient safety. Let us remain committed to continuous learning, interdisciplinary collaboration, and excellence in nursing practice. Our shared goal is to ensure that every SCI patient receives the highest standard of bladder care possible. The selected references for this presentation provides a comprehensive overview of current research and clinical guidelines on bladder management for individuals with spinal cord injury. These references were chosen to highlight the multifaceted approaches required for effective neurogenic bladder management, including routine quality of life assessments, management strategies for bladder complications, and necessary nursing interventions for conditions such as autonomic dysreflexia. Collectively, these articles form a strong foundation for understanding and improving bladder management in spinal cord injury patients, enhancing both clinical outcomes and patient quality of life. Thank you for your unwavering dedication to the health and safety of our SCI patients. Each of you plays a crucial role in preventing complications and improving outcomes through everyday actions, whether it's ensuring timely catheterizations, recognizing early signs of distress, or providing compassionate education to patients and families. Best practices in bladder care are not just checklists. They are life-saving interventions that stem from your clinical expertise, empathy, and attention to detail. As a team, let's reaffirm our commitment to excellence by continuing to uphold evidence-based standards, communicate effectively, and support each other in every patient interaction. Bladder care may seem routine, but in the SCI world, it is foundational to preventing emergencies and promoting quality of life. Together, we make a difference, one patient at a time. Let's continue to lead by example, drive improvement, and ensure safe and respectful care for every veteran and SCI patient we serve. Again, thank you very much.